Hi, welcome to my channel, my DC. Today's topic is differential leukocyte count. Let's study about introduction, types, preparation of blood smear, staining of blood smear, microscopic examination, and clinical significance. Let's go through introduction. What is DLC? DLC is nothing but differential leukocyte count. It is important to diagnose the blood-related disorders like white cells or red cells. It is performed to check the normal numbers or distribution of different leukocytes. It also gives the morphology of different cells. Morphology is nothing but shape, size of the cell. Let's go through types. There are two different types of WBCs. One is granulocyte and other is agranulocyte. Granulocyte is nothing but it is a characteristics of presence of granules in the cytoplasm. Granulocytes are classified into three types: neutrophil, basophil, and eosinophil. Let's go through neutrophil. Neutrophil, it is also known as polymorph or macrophage. It is a type of WBC and a granulocyte. There is a presence of granules in the cytoplasm. It is about 65 to 70%. It takes both acidic and basic stain. The nucleus is about 3 to 7 lobes. The lifespan is 3 to 5 days. Its diameter is 12 to 15 microns. It acts as phagocytic in nature. Basophil. It is also a type of WBC and granulocyte. Cytoplasm contains small rounded granules. It is about 0.005 to 1%. It takes basic stain. The nucleus is usually kidney shaped or slightly lobulated. The lifespan is 8 to 12 days. Its diameter is 8 to 10 microns. It secretes a chemical substance known as heparin, which prevents the clotting of blood inside the blood vessels. Eosinophil, also known as bilobe cell, it is also a type of WBC and granulocyte. It takes acidic stain. Its diameter is 10 to 12 microns. It is about 1 to 6%. The lifespan is 8 to 10 days. It protects the body by releasing a chemical known as histamine. In case of allergic conditions, the eosinophils increases in number. Next, agranulocytes. Agranulocytes is the other type of WBC. It is characterized by the absence of granules in the cytoplasm. Agranulocytes are also been classified into lymphocyte and monocyte. Lymphocyte is a type of WBC and it is a agranulocyte. There are two types of lymphocyte. One is small lymphocyte and other is large lymphocyte. Small lymphocyte. The nucleus is relatively large in size and round in shape, which occupies major part of the cell. Diameter is 8 to 10 microns. It is about 50% in birth. In adults, it's 20 to 30%. Lifespan is too short, less than 24 hours. It produces an antibody. Large lymphocyte, its diameter is 15 to 18 microns. The nucleus is centrally placed. It is small and round in shape. The living large cytoplasmic area. It is about 5 to 10%. The lifespan is few hours. It produces an antibody. Monocytes. Monocytes is a type of WBC and it's a type of agranulocyte. It is the largest cell of all WBCs. The diameter is 15 to 18 microns. Nucleus is kidney shape. Nucleus is eccentric. Eccentric means the nucleus is not placed at centrally. It is about 2 to 6%. The lifespan is 1 to 2 days. It acts as phagocytic in nature. Let's know about preparation of blood smear. How to prepare the blood smear? First, we should take a clean grease-free slide and obtain a capillary blood direct from the finger or EDTA on the slide. Place it on a corner of the slide. Take a spreader, touch edge of the spreader to blood drop on slide. Slightly push it backward so that the drop is spread evenly to the edge of the spreader. To drop on slide. Slightly push it backward so that the drop is spread evenly to the edge of the spreader. Now spread blood with the help of a spreader across clean grease-free slide. There should not be any air bubbles. The smear should be obtained in tongue shape. Let's know about staining of blood smear. Blood cells have different structure which takes different stains. The blood smear is stained with a combination of three stains. They are called Romanowski stains. Types are Leishman stain, Giemsa stain and Wright stain. Let's know about Leishman stain. Leishman stain is the most common and cheapest stain among all the stains. It is commonly used composition Leishman stain powder is 0.15 grams methyl alcohol, and blood films are placed in staining rack. The blood film should be dry and it should be covered with the Leishman stain. The stain should be evenly distributed over the slide. After 1 minute, add distilled water or buffer solution. Keep it as it is for 7 to 8 minutes. Then wash the slide with distilled water to remove the excess of stain. Observe under oil immersion objective in the microscope. Let's know about microscopic examination. First, examine the stained blood smear under low power objective. Note the background color and distribution of cells. In an ideal staining smear, there are 3 zones to be identified. The thick area or head of the smear, the central area is body, at the end of the smear is tail region. Choose the portion of the smear in the body region slightly before the tail end. Observe the slide in oil immersion by putting a drop of oil over the slide. Examine the slide in tail region using oil immersion objective and move the slide in serpentine method. Count each type of WBC observed. Note it in a paper or a cell counter. Continue the counting till 100 cells have been counted. Let's know about clinical significance. The basic use of differential count is to identify the changes in distribution of WBCs. These changes are related to specific infection like bacterial infection, viral infection, parasitic, leukemic, etc. Neutrophils. In high condition, it is known as neutrophilia. They are infection, non-infectious inflammation, injuries, surgeries, heart attack. In low condition, it is known as neutropenia. They are seen in suppressed immune system, bone marrow failure, aplastic anemia, hepatitis A, B or C, and sepsis. Basophil. In high level, they are seen as hypothyroidism, myeloproliferative disorder, polycythemia rubra vera, myelofibrosis. In low level, hyperthyroidism, infectious. Lymphocytes. In low level, it is known as lymphocytopenia. HIV, influenza, steroid use, radiation therapy. In high level, it is known as lymphocytosis. They are seen in adenovirus, hepatitis, influenza, tuberculosis, brucellosis. In monocyte. In high level, it is known as monocytosis. They are seen in mumps and measles, parasitic infections, tuberculosis, chronic inflammatory disease, chronic myelomonocytic leukemia. In low level, chemotherapy and radiation therapy, HIV and sepsis. Thank you for watching. Please like, share and subscribe.